Good evening. Thank you. Beautiful, beautiful audience. My name is Ron Bridges. I'm state director with AARP Kentucky, and we're very, very proud to be a part of this effort here in Louisville. As mentioned, I've been with AARP for the last 10 years here in Louisville, a total of 25 years with AARP across the country. And I was reflecting on the remarks that Bill Novelli was making this evening. It brought me back to 2005, 2003, some of the victories that we accomplished for citizens just like you and me. Part D, prescription drugs. I was in the trenches as Bill Novelli was leading AARP and other groups to make historic transition in the Medicare program. A couple years later, I was in the field working again under Bill Novelli, and we were able to push back on the effort to privatize Social Security. Again, that's something that is keeping so many of us out of poverty. So I say all that because we've got a team here in Louisville that is led, C-TAC, led by Overburdened, who I was introduced to by a colleague from AARP who said, I've got this dynamic minister in Louisville that I have to have to meet. So Tahisha Rollins, who is our community outreach director, and I, Pastor Willie, we got together in the AARP offices. It was the first few days of COVID. You know, we were all staying a little bit far from each other, but we felt that connection. That connection has evolved, and tonight we get this kickoff. I'm so excited and proud. Something that I need to touch upon also is my years before AARP. I led the DC Lung Association back in like 1980s. And who was there leading the way to prevent another generation from being susceptible to big tobacco? Bill Novelli. So I've watched, I've seen the efforts that he's been able to lead and the victories that we've been able to achieve. And I think Louisville, you've got a great partner in C-TAC to help you do what you decide needs to be done for our citizens and our community. AARP is so pleased to be part of this. And I want to recognize one of our executive council members, Mr. Charles Williams, who leads the effort here in Louisville with the community advisory team. Please, let's stand up, Charles. And the stories I can tell you what I've been able to gain from his work. Around such folks, you have to be a sponge because there's so much to learn, so much that can carry it on to the next life. So, caregivers, I'm so pleased to be in your presence. Things are changing. Things are changing. The John Hartford Foundation recently conducted a poll that says, regardless of where these folks are coming from, whether you're a Republican, Democrat, whether you're wealthy, whether you've got education, they're all across the board saying we need to do something more for caregivers. And I think tonight marks the launch of what we're going to do for caregivers and what caregivers are contributing back to us begins tonight. AARP has been working in the area of addressing disparities and trying to bring about more equity in the delivery of health care for a number of years. It's rooted in our mission. And I think the challenge to help folks live their best lives encompasses what it is we need to do to fight racism and ageism. And so you'll see us at the forefront moving forward. But if we reflect back to what the Hartford folks have revealed to us, that means a state, purple, red, whatever Kentucky happens to be at the moment, will have an opportunity to make some changes, to make some inroads into what needs to happen for caregivers. So you'll find that the session starts in a couple of weeks. AARP will be up in Frankfurt, fighting for family care leave, fighting for opportunity to take time off of work so that you can care for your family, respite care, protection from fraudulent access to seniors' bank accounts, those things that will protect guardianship. Those are the kinds of things that we view will help and, in fact, make it more powerful for caregivers to do their work. Wanted to touch quickly upon the disparities project that we had engaged the Louisville Center for Health Equity to look at the problem around health disparities, particularly in communities of color. The findings, nothing new. Those root causes, those social determinants of health, are things that we can and must address. And you'll find out later tonight that that is what this Louisville project is about. Making a difference, addressing those social determinants of health, making sure that we as a community are making a difference for those vulnerable neighbors, those vulnerable seniors. Because face it, we're either going to be caregivers ourselves, we're going to have care delivered to us, or we're not going to be around. One of those three choices. And I think the movement that Elder Overton, the partners are engaged upon this evening will take us a long way towards those successes. In conclusion, I salute you caregivers. We appreciate having the opportunity to be with you all tonight. And thank you, as I said, without you, our healthcare system would just fall under its own weight. So whatever we can do moving forward, public policy, funding, all of the above, are going to be some things that we're going to try to do, but listening to you and not dictating what the answer is going to be. And that's the beauty of this project. It's collaborating but listening. And the folks that came in from C-TAC and partner organizations, that is at the core and the heart of the good that they want to do. Thank you.
When you registered, you should have gotten part of this. Okay, yeah. Oh, okay, all right. Okay. All right, so without further ado, okay. Ticket number 2612992. Let's move on.
Say it again. What was it?
261 2992. Okay, no, we'll move on. 261 2911. The next one is 261 2903. What?